At first glance, I thought this was just a piece of cotton stuck in the ear. This patient came to see me because of persistent tinnitus. During the endoscopic examination, I noticed a white, cotton-like material inside the ear. But after taking a closer look, I realized something completely different. It was a layer of white fungal growth covering the eardrum. Fungal ear infections can have many different appearances. They may look like thick debris, moist discharge, or small white flakes. In this case, the fungus had formed a thin white layer directly over the eardrum. When fungal debris covers the eardrum, it can interfere with normal sound transmission and cause symptoms such as tinnitus, a blocked ear sensation, and hearing loss. Because the fungal layer was firmly attached, I had to carefully separate it from the ear canal using specialized instruments. The portion attached to the eardrum required even more delicate handling to avoid causing injury. Once the fungal layer was completely loosened, I gently removed it with forceps. After the debris was cleared, the eardrum could be seen much more clearly. If you have persistent ear itching, tinnitus, a blocked ear sensation, or hearing loss, don't assume it's simply earwax. Avoid cotton swabs and see an ENT specialist for proper evaluation and treatment.